All right, folks, here we go. Wednesday, 11 a.m. It's another beautiful summer day. Bring on the questions. We're going to kill all of them.
Hi, everyone. Today's first question is a pretty cool one because it's from someone who tried the Holy Hip Healer and they did all the exercises and had like pretty good feedback. But they did mention that, especially in the first round, when they did the template for the first time, they felt their lower back when doing the chainsaw rope pull. And their question was what to do. What am I doing wrong to feel my pain, to feel my back?
Okay, so first of all, that's great. And even that there's slight discomfort in your lower back, that's great because that means you're trying something. Okay, so gold medal for you. I tip my hat for actually doing stuff and figuring out, okay, this is not how I should be doing. Because that's actually how we learn as humans. It's not we like to learn the way that okay, I have to do 10 things and I'm going to do 10 things and all 10 things are going to work out perfectly fine. And at the end of those 10 things, I'm going to be a wise man at 19 years old. So this is what we're thinking this is going to happen. And what actually happens is we have to try like 3,000 things to figure out that 2,990 are not working. So 10 at the end of the day, after like 5 years, are left that are actually working. So I'm tipping my hat. Let's go into the weeds here. That's normal. Most people start feeling the lower back first when trying to do the chainsaw rope pull. Okay, quick summary. What is the chainsaw rope pull for? It is position with tension. It is learning to bring your hips forward using your glute max, producing tension. That means the muscle is getting shorter. So that's the bottom line. Chances are this is for that person, this is an area of that needs improvement, right? Because, well, guess what? They're not skilled enough to use the glutes, so they're going to use their back more. Technically speaking, um, especially when you're in the starting position, so you're bent over, you're grabbing the rope or grabbing a sandbag or whatever it is, and you come up, there's a high chance that you're going to flex and extend your lower back to kind of overarch and bend at the lower back level rather than actually using your glutes and your hips and swiveling at the hips, right? So that's perfectly fine. Okay, why are you normalizing pain, Greg? I'm not, but I'm saying this is nothing. There's nothing to change here. There's just more work that needs to be done. There's more time and there's more practice and a little bit of probably like cueing on a coaching side. Practical tips. If I teach this, I've actually done this last Friday in the hip mobility workshop. So if I and somebody in the gym has actually never done a chainsaw rope pull, well, to be fair, this just started a couple of weeks ago. Um, so the only thing I have to take care of, okay, wherever your knees in your starting position over your ankle, leave it there and try to bring your hips forward, right? A lot of times, and this is very practical now, a lot of times when you try to move your torso up, swirling at the hips, that means shifting your weight forward, pressing your knees forward, which is not bad per se. The only issue is you're letting go of tension in the hamstring and tension in the glutes, and something has to take over, which is in that particular case, in that exercise, is going to be the lower back. So, good measurement tool for you out there is okay, don't judge yourself on one session, right? It's normal to feel back pain, which usually means your lumbar erectors, so the lower part of your lower back, is gonna tension up, right? It's not actual pain. It's more like blood flow in there, and it's more like a discomfort feeling than actual sharp pain
Mhm.
in your spine, right? So this is normal in the beginning. What I'm interested in is kind of according to the last rep rule is that improving over your sessions? That means in the second session, is it less or more? Is there more blood in your lower back or is there more blood in your glutes? More blood in your glutes, still a little bit of discomfort in your lower back, winning. If you're in session 10 and you're still feeling the same amount of blood flow or discomfort in your lower back, and still almost nothing in your glutes, that's not winning. Okay. If that's the case, take a video, send it to me, and we'll talk details about whatever you're doing in the chains to rope pull. If you're afraid of sending me a video, here's again 2 pointers. The hip rolls mean your knee stays above of your ankle, and you're going to try to get to a neutral hip using your glutes. Those are the 2 things that you can take care of doing your chains or rope pulls, and make sure there's more blood coming into your glutes than in your lower back. If you're super, whatever, disappointed, and if you've actually done 10 sessions, send me the video and we'll talk about
Okay.
it. So let me add something. Don't freak out, right? I think we're freaking out way too fast nowadays with some discomfort or something that's not your normal at the moment, which means this could be a good switch of behavior. Could actually be a really worse switch of behavior too. But like, be aware of what you want to do, where you want to get the most blood flow in, but don't freak out about it. Like, nothing's happening just because your lower back has a little bit more blood than other regions. All right, don't freak out. We're gonna fix it.